Hey guys, it's Ashley Francis here with Blue Sage Counseling and Wellness, and today we are going to talk about the top 5 reasons why therapy doesn't work. That's right out of the therapist's mouth, why therapy doesn't work. So first, let's talk about who this video is intended for. It's intended for folks that are currently in therapy who don't really feel like they're getting the most out of the experience. It's also for people who have been considering therapy but have been a little hesitant to get involved because they've been questioning whether or not it really works. Maybe they've done some research and talked to other people that have done therapy, and there are some horror stories out there that have made you hesitant. So what I want to do is talk about what are these reasons why therapy hasn't worked, generally speaking, and then we can talk about some of the things to fix the problems and make it so that your therapy experience is as optimal as possible and you get out of it exactly what it is that you intend to. And really what this comes down to is a good fit between you and your therapist, personality-wise, but also making sure that you're paired with a therapist that has you set up for success as well. Let's talk about what those top 5 reasons are as to why therapy doesn't work. So the first reason is because goals are not clear nor realistic enough. So something that I like to do in the beginning of therapy, right from the outset, is to put together a treatment plan. And typically most therapists do this, if not all. You have to have a good idea of what it is that you're working on. Why is it that you presented to therapy? And how is it that you're going to know when therapy is done? That's the biggest thing. One of the biggest complaints that I hear from clients is, well, I feel better, but I can't really tell if it's been effective. How do I know when it's done? I feel better, but does that necessarily mean that I got out of it what it was intended to do? And if you're feeling that way, then the go-to answer is probably not. There's more to it than that. So that's why it's so important to get very clear on the goals and making sure that they are specific and they are as realistic as possible. So a quick note about the goals being realistic. I'll use an example. So sometimes clients will come in and they state that their goals are to completely do away with their anger or to just simply not feel this way anymore. And I like to take the time in the beginning to provide some education that more often than not, that's not even possible. It's not possible for us to stop feeling any sort of way because feelings are natural. They're indicators, they're warning signs, they're ways of getting our attention. We actually don't want to stop feeling because if we stop feeling, then we wouldn't have any indication that there's more to be looked at or that provides a roadmap to the root of the problem. So I like to provide some education that those feelings are there for a reason, and it's not really realistic to try to get rid of them. But rather, the focus is more on being able to manage the symptoms, manage the feelings, to increase your tolerance for anger or adversity or conflict. Focusing on those types of skills will have you more set up for success from the beginning versus just simply trying to work towards minimizing or doing away with feelings altogether. I'd like to explain to clients that therapy without specific goals is like trying to put a desk together without the instructions. It can be done, it can be successful, but a few months later you start to notice that it's a little lopsided, or you also start to notice that the drawers aren't fitting as well, or maybe they're not fitting as well as they once were in the beginning, simply because the structural integrity was compromised because we didn't put the desk together the way it was intended to. So this is another way to think about that too, that if we have something that is concrete and specific and it is created by the designer, in this case it would be the therapist, then it there again increases your chances for success out of the therapy experience. And here is a formula that I like to use that sort of summarizes all this. Knowing exactly what you're working on and or towards, plus knowing an estimated end date equals higher commitment and highest probability of getting what you need from therapy. So imagine going into it, you know exactly what you're working on. It's very specific. The goals are realistic. You're going to know exactly when you're done with therapy. And it's not just because you feel better, but it's because you got to the root of the problem. We'll talk a little bit more about this here in just a second. But the other added bonus is that you know when it is over, so that you have inherently more commitment. If you're going into an endeavor and it's just kind of open-ended, we figure this out as we go, your commitment is not going to be as strong. So if you know that you are to commit to 8 sessions consecutively, that's what's expected of you, automatically your commitment to what you just signed up for is going to be higher, which translates to having better results. Okay, so let's talk about number 2. Expectations are not clearly communicated nor committed to in the beginning. So here's an example of how both the therapist has a responsibility to you, and then you also have a responsibility to yourself throughout the process. So from the outset, it is imperative that the therapist clearly communicate what it is expected of you both during and in between sessions too. That's a kicker right there. It's not only what you're doing during the sessions, but you're also expected to work during the session, in between sessions as well. So let me provide some examples. On the lower end, when we talk about working in between sessions, that simply means that you're thinking about the things that have been talked about. You're going through your day and you're noticing, okay, that's where that's showing up. Or I'm having this conversation with this person and my problems or my symptoms are showing up there. You might want to jot some things down so that you can bring it to your next session. So that's more of an informal way of being able to work on things. And the higher end, the more formal way of doing work in between sessions is to have actual exercises or homework. And a lot of therapists will do this, but not all. And to be honest, sometimes I have homework and sometimes I don't. It really just depends on what's going on with the client. We have to be cognizant of pace and what's going on with them, their stress level, various things too. But regardless, the idea is that you are expected to work. If you are just setting aside 1 hour a week to focus on your therapy, and then as soon as you leave the office, you're not thinking about it anymore, you're not going to get out of it what it's intended to do. You're supposed to observe what's going on, how these things show up in your life in various environments, and practice the skills that are being taught. If you don't practice the skills, you're not going to get very much out of it. You're not going to have very much progress. And it's important that the client commits from the beginning, from the very beginning of treatment, so that things are not disorganized, because then it can become less effective. There again, it's in line with knowing what's expected of you from the outset, and it increases the chances of your success. Number 3, you're doing the work at the request of someone else. So it's not uncommon for me to get calls from parents or a loved one or family member that is calling on behalf of someone else. And there's absolutely nothing wrong with this. Most of the time, the person that is calling is feeling desperate. They are calling out of love and deep care and deep affection for this other person that is in trouble, and perhaps they just don't have the skills or the readiness to be able to reach out for themselves. Again, there is nothing wrong with that. However, what I've noticed is that sometimes in these cases, the client is coming into the therapy session and the therapy journey, and they're not as committed as they necessarily need to, because really it's the person that was calling that wants it more than the client does. Again, this is not always the case, but sometimes it is, and that can mess us up from the very beginning, because then that person is also coming from the mindset of, I'm only here for my mom, or I'm only here for my dad. I'm just checking something off the list because it's something that they want me to do. You are not likely to get very much results out of your therapy if this is the case. Even having just a little bit of buy-in, a little bit of curiosity in the beginning is enough to really get started. But the expectation is that is going to continue to grow. You become more curious, you get more bought in, and then you become 100% bought in and 100% responsible for your own actions, thoughts, behaviors. And clients get the best outcome when they demonstrate personal buy-in, such as covering a portion of the cost for their own therapy. Sometimes this is something that I recommend, especially if it's a minor, but if they are of working age, it just provides another layer of perceived value. So if you are paying for something, then you must attribute a certain amount of value to what you are putting your money towards. So this can sort of put an underlying commitment into the process, just simply because when we use money, we attribute value towards what we are putting it towards. Another idea is that we want to provide a written summary of how the session has gone and then provide it to the loved one. We want to be careful here because this does not necessarily mean that you need to break confidentiality. You don't need to provide details, but rather just an overall general summary of how things have went, so that the person is taking accountability. And then also another idea is to make sure that that loved one plays a part in the therapeutic process. It doesn't necessarily need to be something direct. Sometimes it can be, but it doesn't have to be. So for instance, perhaps the therapist is checking in with the loved one once a month just to make sure that things are on track and that they have access to the information as to what is going on with the therapy with the client. And also it can provide some ideas of how they can help support the client as well. Again, we need to be really careful there to make sure confidentiality is intact. So number 4 is that therapy isn't prioritized. This is something that I oftentimes see, and this is not coming from a blaming or shaming place at all. Listen, I know that life is busy and there are a dozen other commitments that you've got to tend to. I totally get that. But what I want to encourage you to consider is that therapy is one of the highest forms of self-care that we can possibly do. And if we're not taking care of ourselves, then we are in a state of either acute or gradual breakdown. In other words, it's either something that is going to come back and bite you in the near future or in the far future. It's in your best interest to make therapy a priority so that you can get to the root of the problem, you can work out the issues, and get back to living your life. You don't want this to be a drawn-out process. If you commit to it, you come consecutively, you do the work, you can get as much done as you need in about 2 to 3 months. And sometimes I've seen people drag it out to 6 months to a year, when if they really just were committed from the beginning, they would have been in and out and back to the life that they were wanting to achieve. So it's important to make that a high priority and a commitment. And also you want to ask yourself, what other self-commitments are you not keeping to? This is not just therapy, but if we see this happening, there's also most likely other places in your life where you know you need to take care of yourself, but you're simply not doing it. And there again, that leads to or contributes to that gradual decline. And if that happens, then you're on a track to a major breakdown or considerable distress at the very least. And finally, it's just important to keep in mind that if you don't fully address the problem, it's simply going to come back. If you were to attend for 2 or 3 sessions and you felt like you got what you needed, you're feeling better, but didn't really get to the root of the problem, it really is just a matter of time before that problem is going to come back. So you got to ask yourself, do you want to just dig in and get it over with now, or do you want to drag this out? And the final reason why therapy doesn't work is because you quit when you feel better, not when you've reached your goals. So this is sort of in line with what we were just talking about. It's a common misconception that therapy is over when you feel better. While this can be true sometimes, therapy is actually over when you've achieved your goals. This was what we were talking about in number 1, when we're talking about setting specific realistic goals. This also reinforces the importance of that. Once those things are deliberately and very, very clearly set, then we can go back to those goals and ask ourselves, is therapy really done just because you're feeling better? Oftentimes I hear clients say, I don't really have much to talk about today because I'm feeling better. There's not really much going on. And that's okay. There's nothing wrong with that. But what we do in those situations is we go back to the treatment plan, we review what the goals are, and we have a discussion about what have you achieved and what have you left to achieve as well. And it's really important to be honest with yourself as well as your therapist during this discussion so that we can really dig down deep and make sure that the goals are being addressed in the way that they're supposed to be addressed. And we're pushing ourselves out of our comfort zone to be able to uncover things that we're not able to see ourselves. And discontinuing treatment prematurely is like putting a Band-Aid on a large wound. It can stop the bleeding and it can contain the wound, but it's still at risk of getting infected, getting worse over time, and of course, simply coming back. Oftentimes what clients present to therapy for are problems that can only be seen on the surface. However, through the process of effective therapy, the true source of the problem can then be identified and properly treated. This results in significantly less pain and suffering in the future and reduces the chances of causing distress later on. So another way of saying that is you've got a pretty good idea as to why you've reached out for help. And as you start to work on those surface level problems, through effective therapy that is designed to, again, push you out of your comfort zone, we start to uncover things that are lying in the subconscious or the unconscious that you did not have access to in the beginning. So this is one of the biggest things that I like to drive home, is that we are only looking at a certain percentage of the problem if we're only talking about what's on the surface. So it's important to be paired with a skilled therapist that is providing effective therapy, that is encouraging you to dig deeper and engage you in exercises that are actually designed to be able to get to the lower levels of consciousness so that you can uncover those things that you're not able to see on your own. Not all therapists are trained in these types of exercises, and that is not to say that therapy can't be effective simply by focusing on the surface level problems. It absolutely can. But my bias is that if you want to get to the root of the problem and to be able to provide solutions that really stick over time, these types of exercises are absolutely mandatory in order to, I say fix the problem, but to be able to treat the problem as best we can. That will do it for today. Those are the top 5 reasons why therapy doesn't work. I'd love to hear what you guys have to say about it, what you think. Leave it in the comments below. If you like this video, give it a thumbs up. And also don't forget to subscribe to our channel to see more videos like this. Take care.